Welcome once again to Church Alive, and this is your host and president of Church Alive Development Corporation and the proud pastor of Church Alive Community Church. And once again, we're here to bring you quality information, resources, and services. And we've done this for over 30 years, and it's been a delight to be able to bring you this kind of programming from week to week. Well, we have a special guest. And he's really not a guest because everyone probably watching knows who he is, and that's Dr. Tommy O. He had his own show right here, and he's a great physician throughout the Bronx area, servicing literally thousands of people, not only with on-hand medical service, but through information. And a wonderful program, and won many awards called Ask Dr. Tommy O, and he's with us today to talk about marijuana. Now, when I say marijuana, everybody says, wait a minute, where you going, Reverend? No, I'm talking about medical marijuana. We're going to get a good understanding of what it's all about. Dr. O'Brien, welcome once again.
Bishop, it's a pleasure to be here.
Once again, that's a whole lot of once again.
That's right. Well, it's family. We're family.
Exactly. Here's my physician, folk. I want you to know, and I'm his pastor, folk. and he's not only a doctor, but he's a ministering doctor, because everybody sees him and they want to qualify him because of the holistic approach that he's taken to medical care. All right. Why did you get involved with medical marijuana?
Right. Well, I'm asked that question quite often. It's quite simple. It's an extension of who I am. As a family practitioner, right, I was board certified. I did my residency in family practice. It's just a part of the scope of my practice. So to understand what the scope is of a family practitioner is, we say from womb to tomb, meaning I was trained to deliver children all the way up to geriatrics. So let's start at the beginning of the spectrum. We have what's called acute care or urgent care, and then we have the next phase would be continuity care or concurrent care or continuous care. The next phase is which I am now focusing on by treating individuals with medical marijuana. That would be compassionate care. And then the next phase would be your palliative care. And that would be your very end. Again, we started at the beginning where your urgent care today, and then on the exact opposite, 180 degrees on the other side of the spectrum would be your palliative care. And as for managing patients that have end of life aspect, and where I want to make them comfortable so they can spend quality time with their family. All
right, we made something a little difficult. Now we're going to make it simple.
Yes.
What is medical marijuana?
Yeah, well, medical marijuana is a term that we use. It's marijuana, but being used in a medicinal way, meaning treating medical pathology, medical conditions. What's very important is perception. Perception is reality. First and foremost, we do not smoke in New York State. So it's not like someone's going to be smoking a joint and getting high.
Right.
That's not what New York State allows.
Right.
It's about my mission in my office is to make my patients comfortable and functional.
So they don't come there to get a joint, so to speak.
No, that's funny. Yeah. A couple of my friends asked me, said, "Oh, are you gonna have samples in the back?" And you're gonna have a smoking room. I said, "No, It's not a head shop from the 1960s. It's very specific. It's extremely controlled. New York State has very, very strict rules. It's probably one of the strictest in the United States. It's very difficult to obtain the medication, and that's another point. Since I spoke about medication. From this point on, let's think in terms of natural medication or a natural supplement. From that, we're not going to think of drug, because if you think of drug, the first thing that comes to mind is someone smoking a joint and getting high.
I think we need to get into the point of compassionate care.
Yes.
And for folk to understand really what medical marijuana is and your services that you provide.
Sure.
Compassionate care.
Compassionate care is really caring about people's conditions, especially chronic condition, like I said, where we have the compassionate and then the palliative care. Palliative care is the end life where someone's dying from cancer or they have a medical condition which is basically terminal. And what do? We basically treat them with synthetic medications like a synthetic heroin just to basically have them sedated and medicated And compassionate care is caring for them. I explain from my patients that I want you comfortable and functional so you can spend quality time, what remaining time you have with your family. If you're medicated on morphine or a lot of Percocet, you're in a stupor. You know, how can you spend quality time with your family? You know, I want my patients that are terminal to try to eliminate and reduce as much pain and suffering so the family can spend quality time and at least hold their hands and have a conversation with them and say their goodbyes. You know, make sure they know that their loved ones are saying, I love you, you know, and I'm here for you at the very end, because I don't know how much time they're going to have. It could be days, it could be hours, it could be maybe a month. I don't know. They're in hospice care. And make them feel good and at least say goodbye. How many people say, I wish I could have, just one more hug, one more kiss, or just to tell my significant other, I love him, I miss him, I'm going to miss him.
Right.
This, you know.
Well, what the conditions that make a person eligible, they're serious conditions.
Yes.
And you really have to be compassionate for those who come into your office. Tell us about that.
Right. Well, it's a good thing that you just mentioned that. I introduced medical marijuana to several of my friends who I felt that their personalities would fit this niche, because it is a niche. It's not for everyone. And a friend of mine that we work together, he's a physician as well. He just says, Tom, it's not for me. It's not for me. And he just did not feel comfortable treating this population. He said, it's not for me. So compassionate care is not for everyone.
I've heard that too. When I said to people, I'm a pastor, I'm pastoring a church, and they say, it's not for me, for what you have to deal with.
Right. Yeah. Well, it's very draining, and you have to understand that the patients have a lot of questions, and they're going to pull a lot of energy from you psychologically, because some of them are desperate. It's like I said, palliative care. It's at the very end, and they're looking for some hope. And as a physician, you know, we're talking about a science and an art. Well, this is something a little bit different, and my goal is to, and this is something we always speak about the spiritual. That's and right. That, you know, we say we're the God Squad. You know, the minister, spiritual minister, and minister of health. And I explain to my patients, my job is I look at you holistically, and I've said that, and I've trained that way, and you know, we're raised exactly the same way. Right. The mind, body, spirit, mind, body, soul. And I want to, you know, bring that spirit out and see you feel good about yourself. You know, really, I want you to focus. Say, I can do it. I can beat this. I can do it. And my job is to pump my patients up, make them feel good.
I think the audience needs to know what kind of illnesses come into your office.
Right. Well, New York State's only approved just a selected few diseases, pathology, medical conditions. And the first would be seizures, epilepsy. We have AIDS and HIV. We know HIV, and once you your CD4 numbers drop below a certain level, you become or show secondary and tertiary pathology. Now you're in full-blown what we call AIDS. Also, Parkinson's disease, Huntington's chorea, ulcerative colitis, Crohn's disease, neuropathies, and what else?
Did you mention cancer in there?
Yeah. Well, you'll miss that. It's big. Yes. Yeah. Cancer as well. And then we have patients will call up. Well, pain. I'm suffering from pain. I'm suffering from nausea and vomiting. I'm losing weight. Those are really characteristics or symptoms of the primary diagnosis. So if you have those, they do not qualify. You must have a major medical condition that New York State approved. Right now, sitting in front of the board is post-traumatic rheumatic arthritis or RA. There are a few rheumatoid arthritis, and a few other medical conditions that are sitting in front of the board. When are they going to be passed? I don't know, because our patients call. I have RA, I have this, especially our military brothers for post-traumatic syndrome. It's just a matter of time that will be passed.
Well, you know what? Not many doctors are available to treat these needy people, people who are in this crisis. And how does he obtain the ability to do this? Because you just can't open and say, I'm going to do this.
Right. Well, there's a process. And the first is you need to want to care for these patients. You want to provide compassionate care. once you say, I want to treat my patients compassionately, I mean, doctors treat compassionately, but we're saying compassionate care because it's called the Compassionate Care Act. Then what you do is you would go to New York State's website and you fill out some documentation, and then you would take a course. There's an online course. It's a 4.5-hour course, and then you can take the class. You must pass, have a 70 or higher to pass, and then you're certified and you can start treating patients. But it's more than that. When I was certified, I took the 4.5-hour class. I didn't feel comfortable because there's a lot more to learn about medical marijuana. I spent several hours and I read a lot of articles before I became comfortable, before I saw my first patient. So it's up to the physician to do, you have to self-teach and you have to do a lot of learning like we were doing in medical school, so you can feel comfortable and then you can start treating patients.
Well, suppose the person comes in and there may be more than one illness that they have.
Yes.
How does the treatment go beyond marijuana, medical marijuana?
Sure, that's a good question. A lot of patients have several diseases, and we know statistically and through studies, Toronto, up in Canada, Israel, Tel Aviv, Spain, this is where all the studies are coming out from, that medical marijuana treats more medical conditions than New York State's approved. So I will have patients that will come in with anxiety. I will have patients come in with post-traumatic syndrome. Does not qualify. However, they do have a qualifying medical condition. I can develop a treatment regimen that will treat all their conditions because I get to treat, I'm able to develop what we call a cocktail where a ratio, a medical marijuana ratio, and we can go into that, and where I'm able to treat multiple conditions and just tie it in as a nice package.
Right, so that allows you to actually, or the patient and those who are watching, because you have a lot of people that are watching this program right now in the Westchester area. We want to welcome them to Church Alive, and then we're new up in that area. In Yonkers, of course, we become a real staple. And of course, the Bronx, and we want all our folks to know that this treatment is available not only for dealing with marijuana, and it's not dealing with marijuana, it's marijuana being used to treat a illness, a terminal illness that you might have. Am I correct on stating that?
Yes. Well, let's back up a little bit because I want people to really understand what medical marijuana is.
Right.
First and foremost, marijuana is called cannabis. Cannabis, the plant, has oils. Within that oils, there are 400 chemicals. Out of the 400 chemicals, there are 60 that have medicinal properties. So the chemists extract out just the molecules that have the medicinal property. So if you smoked a joint, you'd have all 400 chemicals. When I'm treating you, we're dealing with only 60 chemicals that have the medicinal properties. The two main chemicals that we use, and then they have subderivatives of those two main chemicals, are CBD and THC. CBD, cannabis, cannabidiol, CBD, and THC, tetrahydrocannabinol. Those are the two main molecules, and with their subderivatives that have the medicinal properties. Each have receptors in the body, which is called, I'll develop, because then we can really expand. The body has the endocannabinoid system, and what that means is that we have receptors in the body that those chemicals will bind to, and it has an affinity for them. So we'll go through the two differences. Start with THC, and everyone knows THC. When you do a urine test, it comes back positive. You say, oh, you were smoking weed, you busted. THC has receptors in the central nervous system in the brain, and that's why when you have high amounts of THC, you can get the psychoactive, or what's what we call the stoner's high. It also stimulates appetite and sedation, so you end up falling asleep. CBD does not have receptors in the central nervous system. It works outside the CNS. It helps relax you. There's receptors in the muscle tissue, in the GI tract, in the adipose tissue, as well as it helps work on the immune system, so it reduces inflammation and helps treat and fight against cancer, and that's why we use it. THC also helps block pain. It's a great pain reliever. CBD blocks pain, but through muscle relaxation. THC also is able to fight against cancer as well.
Now, what about the dosage? Because that might be a concern of people who are looking at this, you know, and that it can get carried away, or it can become
addictive,
you know, addictive and things like that. I guess there is a component in there, but how is that controlled?
Right. Well, the good thing is this is different than a regular practice. As a family practitioner, I tell you, you have to take this pill once a day, and that's that.
Right.
Here we say self-titration. What is self-titration? The patient self-monitors their condition and they treat based on how they feel. There's a lot of flexibility where we work together and I teach them how to use the medication or natural supplement, and where we use a sliding scale. So if you, let's say for instance, a patient has chronic pain because they have a neuropathy, like a diabetic neuropathy. I give them a specific ratio of THC and CBD, and then I say, this is how you're going to take the medication. How do you take the medication? Before I get into the dosage, in New York State, like I said, it's not a bud, so you cannot smoke it, and it's not edible. So in New York State, you can only use a vapor or oral, where it's going to be sublingual drops, a paste where you can just put it on your tongue and swallow it, or a pill. So what I do is I tell my patients, you're going to self-monitor or self-titrate. So the patient decides, I do not decide, the patient decides on their lifestyle and what they feel comfortable with. Some patients like the vapor, some patients prefer a pill or sublingual. Each has their benefits. Each will also have their negative qualities, because cost and you know, do you want to have, you know, vapor in front of people versus having a pill and it's clean and you're done. Self-titration or self-monitoring, basically you treat yourself based on your needs. If you're in very little pain, then you just take a small amount. If you're in moderate amount of pain, then you take a moderate amount. If you're in severe pain, then you take a larger doses. So you use a sliding scale. You self-monitor. If you're not in pain, you don't have to take the medication.
Right. How has this made a difference in some of the terminal cases that you've been ministering to?
Sure. Comfort. Like I said at the very beginning.
Right. Can you have a case, in fact, not a name, but yeah, let us know how say a case that you can remember that really made a difference.
Oh boy.
I guess it's quite a few.
I do, because I have about 300 active patients right now, and we'll talk about patients and getting the message out, and that's what this.
Yeah, well, that's what in the time that we have, we're about ready to do that.
Wow, I have really, this has exceeded my expectations. I didn't know what to expect, and the outcome is phenomenal. It's not perfect, but I have very, very high success rate. I have a famous actor that comes to me, because I'm in the Upper East Side of Manhattan, and this individual has, I'm not going to go into the disease, because I don't want people trying to figure out what the disease is.
Who you're talking about.
So they have a medical condition, and the past 2 years, their careers, they have no career. And when they came in, I knew who the person was. So we discussed the condition, then I discussed the specifics on what I do, how to do it, and what the requirements of the individual, you know, talking about finishing the registration process. The individual went into panic mode, started severely sweating, anxiety level, started to have tremors, and I just put my hand around him, started to rub his back, and I gave him a hug and says, I'm going to help you, you're going to be fine. I will complete the registration for you. You're going to be fine. And he says, I'll pay you more, I'll pay you more. I said, no, 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 I have you. You're my patient, you're like my family, I'm going to handle this for you. And I started treating this individual. He came back for a month follow-up. I'm in the back of my office. You've been in the office, so you know I have a long hallway, right? So I'm in the back. I just was getting a cup of water for myself, and he opens up the door, and I look down at him. He looks at me, and he gives me this, and he gives me a thumbs up, and I was like, and I said to myself, "What's that about?" So then we're in the examination room, started asking him. I said, "How you feeling?" He goes, "Doc," because I feel good. I said, "What do you mean?" He goes, "Look at me." You know, and now he's not anxious. He doesn't have tremors. He's feeling good. I said, he goes, because he's taking pills. And I said, can I have 2 pills a day? I said, absolutely. I said, how do you feel? He goes, I feel great, but I'd like to see if I can get a little bit more. I said, absolutely. I said, you can have up to 2 or 3 pills a day if you like. I said, but I think 2 pills will be fine because of the half-life of the medication. I said, late afternoon, you can take the second medication. He comes back a month later for another follow-up because he wanted to come back. I said, how you feeling? He goes, gave me a thumbs up, and he's shaking, thumbs up. He goes, great. I said, okay, I'll see you in 3 months from now. That's one story.
And his condition needed it. What was that? You just want to, if you can mention it. So we don't know who he is.
Yeah, I don't want to, because it's one of the conditions I've mentioned.
Okay, good, okay.
Because I don't want someone trying to figure out who the individual is, because it's confidential. I can discuss cases, but I don't mention names. And,
exactly.
You know, it's easier just to say.
Well, we have a wide audience, so that's true. You know, they might be able, sometimes people say, bingo, I know who that is. Friend of mine.
Exactly.
So we can leave it there.
But
this is the kind of situation that comes into your office, right?
Well, that's just one. I have patients that have chronic pain. So now I can broaden it because I'm not mentioning anyone. Chronic pain. And the first thing they say is, Doc, I'm tired of taking these synthetic meds. I don't want to take this. The Percocet, the morphine, the Dilaudid, synthetic heroin. Okay, that's what it is. The narcotics. I said, I'm tired of doing this. I don't have my life. I don't have control anymore. I'm angry all the time. I'm yelling at my wife. My life and my family's falling apart. So I said, this is what I can do for you. This is how we can treat your medical condition, reduce your pain. I'm going to see you in 4 weeks. They come back. I'm getting phone call 2 weeks later because I have to do a 2-week phone call follow-up. I feel great, Doc. I said, all right, can I do this? I said, absolutely. He comes back 4 weeks later. Majority of my patients say, I've reduced half to 1/3 of my pain pills.
Oh, great.
I said, how do you feel? I feel like myself again. I'm able to have a nice relationship with my significant other, my wife or my husband. I feel good. I'm not angry anymore. I'm not irritable. I feel good. I had one person that has HIV, and said to me, I went to 12 doctors over the past 2 years, Dr. O'Brien, and I come to you after one visit, and now I'm starting the medication, and it's 4 weeks later. I've gained weight. I'm in no more pain. I feel good, and I want to go back to work. Can I go back to work? I said, yeah. And I said to myself, why are you asking me? I said, you want to go back to work and you feel good? Go back to work.
Now, we have a lot of people. We're down to 5 minutes, and I can feel my audience out there, and the people that you've been reaching out, saying, how do I get to this doctor? How can I refer my relatives to this doctor? And how can I get this kind of care? So we want to give you this few minutes to just speak to the audience how they can get in touch with you.
Absolutely. Well, first, go to my website, okay? So what I can do is go to my website. Go to www.doctommy.com. That's Doc Tommy. On my website, I have all the information you need, the requirements, New York State, all the information about the state, the requirement, because there is a process to get certified. And then you'd call my office and set up an appointment. There is a process. I am considered like a specialist. I cannot diagnose you. You must have a diagnosis, and then you need information from your physician, a letter, some sort of MRI study or CT or something proving your diagnosis, and then I can see you. You set up or you can just call the office and ask questions. And the number will be on the screen, and we'll be able to, either I will speak to you or I'll have Jasmine, my medical assistant, she'll be able to answer the questions. And if you meet the requirements, I will set up an appointment for you and we'll get you in so we can take care of you and give compassionate care. It's all about compassion. When you're my patient, you become my family. Very, very important. It's really makes a difference. Like I said, I have approaching 300 patients. I'm talking about active patients, and majority of my patients it's a success. Of course, varying degrees of success, but it's success. So my phone number is 212-201-9122. My website's www.doctommy.com. Go to my website, get the information, become knowledgeable. You know, I'm here to empower you with education. The website has education, and right now we're getting ready to launch a new website that it's even more active and has more information. We're going to go into dosing, what to expect. Really, really good information there. So please, give the call. Go to my website, get the information, become educated, call my office, and we'll set you up and I'll take care of you.
Well, I feel for my audience that you've gotten over to them and you've gotten quality information that we always bring you at Church Alive. And Dr. O'Brien is still dedicated. Folk, you don't know how many people that he has serviced in my almost 20 years that we've known, going out into the community, reaching people, yes, being proactive in many cases, staying ahead of the curve to make sure that quality service is given to the people. Yeah, Dr. Tommy O is qualified to be your physician because he's my physician already. But I want to just close by thanking you for allowing us to come into your homes, and I've given you quality information once again. Medical marijuana, we've taken the myths away, and I know you heard, you know, you look in the television and you see all the performers from Michael Jackson, you know, to Prince, and you know, and those are fantasies, and those are areas of medical care far beyond what Dr. Tommy O is talking about. But I will tell you, you know, if they had gone to him, I believe their life would have been extended a lot longer. Absolutely. Dr. Tommy O, thank you so much.
Thank you, Bishop. It's a pleasure being on your show. Yeah. Remember, stay alive with Church Alive.
Oh, you remember that?
Of course.
Stay alive with Church Alive, and we're ending, as usual, telling you with we love you with the love of the Lord. Now, on the screen, you're going to see some information about Bronx Church Day. It's our 35th annual Bronx Church Day. It's going to be held on the courthouse steps. The date is August the 13th. You're going to come up on the screen, and if you want to be involved, or you want to participate in it, or you want to come out as a vendor and enjoy yourself, this is a spectacular day. Every year for 35 days, I founded it, and it's been better and better. So we want you to take advantage and be part of Bronx Church Day Festival. Thank you, and God bless.
As I acknowledge you in all my ways, I am never alone. As I listen and I hear you speak, your words convey a message to me, and you